Hey, what's up, guys? I'm Caden Thompson.
And I'm Nate Blackwell.
Welcome to Selective Wisdom, where we talk about fitness, bodybuilding, life, and everything in between.
We are excited to be here and expand on a range of different subjects and topics we don't get to talk about very often. Let's jump right in.
All right, what's up, guys? Welcome back to your favorite mediocre podcast on the internet. No, I'm just playing. But yeah, what's going on? Welcome back. It's been a couple weeks now. We have a good one today. We're going to go over peptides, and a couple that aren't necessarily peptides, but we want to throw them in here because they're not steroids either. So I'm going to go over those, give you guys some insights on what could be useful to you, some stuff that I know both of us have both dabbled in, and some stuff that I've just kind of done some recent digging on due to some of you guys putting in some questions as well. So yeah, what's been going on with you, Nate?
Man, nothing.
How's the hair healing?
It's
Put
going
the
good.
hat on, bro. I was gonna say, let everybody see. It actually looks much better than I thought it was gonna look.
I'm
It's
gonna
just
put
your
that
other
on.
hair is growing so much faster.
Yeah, so that's kind of the thing right now. Is it's to the point where it's starting to fall out, so it's starting to look a little patchy. And
Because it does
like
that first, right?
Yeah, it's weird because like it looks like I'm going bald, even
But
though
you're
I
not.
know I'm gonna.
Yeah.
No, I'm not. Like, you know what I mean? It's gonna get
Anymore.
thicker. Right. Yeah.
Anymore.
So yeah, I'm wearing a hat a lot again, but trying to keep it off as much as possible. But like when I'm out in public,
Yeah, let it breathe.
I wear
Can't.
my hat.
Mm-hmm.
Also, I don't know if you'll be able to hear, I'm sure at some point, but I got a new cat, Freya.
Mm-hmm.
She's beautiful, brindle. So meaning like she's black and kind of orange mixed together, and
Yeah,
she's gorgeous. She's the sweetest thing ever. And my other cat absolutely hates her. So that's been fun. But other than that
happens because your other cat's very integrated into you guys.
Well, yeah, he's just very used to being. Yeah, he's used to being by himself. The good news, there's some good things. I 3 or maybe 4 things that I've kind of told you, but maybe not everybody else. I've been working out, so I started my workout routine back. I hit legs twice last week. I hit arms, and I'm feeling every bit of it. So I'm excited to kind of get back into the normal flow of like having a workout routine and like not being sore for days and days after. That's going to be fun. I am doing classic physique. So I am going to be doing classic physique. Up. Yep. Everybody for years has been asking me. I was just watching a video the other day, 2021 with Brady, and he's talking about a classic. I was like, nah, I'm going to do men's physique. So classic this year, it'll just be one show, summer shredding, and that'll probably be it. Unless I just go out there and crush it, dude. If I just look freaking good,
you're not doing any other shows besides summer shredding.
I'm going to do other shows, but they're
just not classic. Just not classic. Okay.
Now, if I go out there and I look really good, and I feel like I look really good, then I may go and do a classic show on the NPC level. That would be fun just to do it.
Mm-hmm.
But if it's something I don't really like, I don't really enjoy, then I won't. And then. What was the last thing I was going to say? Workout classic. Oh, prep starts in...
I was going to say, how'd you forget that one?
Yeah, I know. Prep starts in 5 days on Monday. So.
Lucky you.
Yeah. Yep, prep starts 30. I'll be 30 weeks out. 30 weeks out from September 12th.
Seems like so long, but it's not,
bro. It is a long time, but it's also not a long time.
Yeah.
It's not. Especially when you have the ground that I have to make up in the next 30 weeks is just, God, it's going to be hell. It's going to be fun. It's going to be fun, but it's going to be hell at the same time.
Yeah, but that's prep in a nutshell in general.
That's prep.
And you know how it goes, though. From 30 weeks to probably 14, 12, it won't be that bad. And then from 12 to
under 10,
6, it'll be like, this kind of sucks. And then, after like 7.
6 left, it's like, oh.
You're like, fuck. Yeah.
I'm really trying to be ready, though, about 4 weeks out. I'm really trying to be ready.
You want to be ready early.
Because I want to cruise into it, because that's always been what's been best for me, is to cruise into shows, not have to deplete into shows.
Yeah. So I mean, and if you're ready, or especially if you're doing multiple shows, but summer shredding's gonna be your last one, right?
No, it'll be first.
Oh, okay. I was gonna say
it'll be first.
So you can kind of use that. You can kind of use that as your not trial run, but
feel out show.
a lot of people.
Well, that's what I'm saying. Well,
you're going to look
the
much
reason I wanted
better.
to do, the reason I want to do the summer strength show first is because I'm going to be doing classic. When you're doing classic, that you just have to be leaner.
Have to be leaner.
Than for men's physique. So I'll get the leanest I've ever been. If I'm going to look good on the classic stage, I'm going to be the leanest that I've ever been. So, and I'll be the biggest by far that I've ever been. So that is going to be fun to see. It's going to be fun to see where my body goes. It's going to be fun to see where I can take my physique.
Is there going to be anything you're, I guess, are there any peptides or anything that you are implementing this prep that you haven't before?
I will be using, for sure, BPC and TB500. Those two are going to be like staples. A couple of others that I might try that I'm not, just to be clear to the podcasting world out there and just people on this video, I'm not a big peptide guy. I haven't been. But as
in terms of you don't like them, or in terms of you just don't know a lot about them?
I just, for one thing, I don't know a ton about them because I haven't used them. I'm more of an experimental / anecdotal. Yeah, they are. So I don't know, and I haven't had people around me know enough about a lot of these to have like a conclusive, like, yes, this works every single time for this thing, but I know what they're supposed to work for. So that's kind of where I'm going to experiment a little bit on myself this time. I'm going to move my camera.
Well, and the good part is they're not dangerous.
They're not.
You're not going to have anything that's going to give you these major androgenic effects that are going to cause hiccups and stuff.
You're not going to have gyno. You're not going to have acne from these things. You're not going to have. Only thing that you're going to get is like it works or it doesn't. Like that's pretty much it. Yeah. You may have a few little things, but things that I would use would be like CJC. I know you're going to talk about SLU. There was maybe
telling
a couple.
You, bro, you should use that.
It's $200. It's crazy.
No. I found a new source, and it's 70. So the SLU is 78 for a 2-month supply, and the 5 amino, that's the expensive one. That one's 128 for a 2-month supply. So I found a much cheaper supply. But
I'm trying. This is where I'm trying to decide. Right? Is I don't want to throw this is my thing. I don't want to throw a whole lot of things in the pot at one time and not know which one is doing what. Not necessarily that I wouldn't know. I'm more mean like I want to try CJC just by itself and see what it does for my body. So I can be like definitively, yes, this works because of this. And then I'll try SLU. Okay, SLU works because of this. And then the 5 amino, okay, this works this way. But the big thing that I want to add, the one thing that I'm going to be adding to my stack this year is GH. So that's going to be the biggest thing that I add. I'm taking a big step back on PEDs this year. I'm only really going to be running 3 or 4 different compounds. I'm not running Tren. I'm not
which
pushing,
for me sounds astronomical.
What do you mean? Like running Tren, or
I'm pulling back. I'm only using 4 compounds, and I'm like, dude, if I pulled back, I would be using no compounds.
None.
I would be using nothing.
Well, what I mean is like throughout a prep, typically what you'll see is people will switch from like they'll run like you run Anadrol, like you'll run Anadrol, then you'll switch it for Anavar or Winstrol. You'll run MPP at the beginning, especially 30 weeks out. 30 weeks out, there's no reason for you to be running Tren. So like you would switch. MPP,
stop using Tren in the off season, you idiots.
Tren is stupid. Tren, man. If you're on the NPC level and you're not pushing for a pro card, you shouldn't be using Tren anyways. You don't need it.
You don't need it. It's not all it's cracked up to be.
It's not. It sucks, especially if you especially
if you're a bad person.
Aromatize, If you aromatize a lot, like if you have issues with prolactin already and you get on that stuff, bro, you're gonna suffer. But yeah, I mean, the big thing that I'm gonna be using this year is growth. So that's gonna be fun.
Yeah,
that could either be a game changer. Or it could be like this is my physique. My physique is shit.
I did have a conversation with somebody in the gym the other day who is a friend that's like he runs multiple clinics, but he also is a big underground guy. Like he runs the stuff that you can get and prescribe, but he's big, underground, because what we were talking about was the same conversation we talked about, which was the effectiveness of UGL versus, pharma grade stuff. And we had the same conversation, like the what we're seeing from pharma grade stuff for the price versus what we're seeing from a lot of UGLs is like, it's just not worth it to pay that extra money. So I know me and you have talked about, from my source specifically, the GH, like the price is good, and it's when you see that, it's like a too good to be true thing. But a lot of these underground labs, man, are giving us better stuff. And even like I talked to somebody about pharma grade. I've talked to Justin about this too. He spoke on it, like pharma grade, even testosterone being underdosed. Like, if I get testosterone from underground, and it's not going to be from a good, a decent source. It's not going to be underdosed. It might be overdosed, and like at that point, like if it's
you're just getting test, for free.
I'm chilling on that. But yeah, that'll probably be a hopefully a good response with the GH. Mm-hmm.
That'll be it should be a game changer. It should be.
Yeah,
but we'll see. We'll see. I mean, you got guys like
well.
Matt Grego who hop on GH and just seem to grow 20 pounds every offseason.
I don't know what's up with that guy,
dude. He's insane. I was watching him do some bent over rows the other day, and I was just
I watched that video
bro.
too. I said the same thing.
Brady sent it to me, and he goes, "Be this," and I was like, "Bro, fuck you."
Be this. Yeah, let me wake up tomorrow and be Matt Grego.
Yeah, sure. Let me wake up tomorrow and grow 15 pounds just by looking at the weights. It'd be awesome.
I wish.
But let's get into this thing.
We had a couple I want to touch on first, just as they weren't things that I was too keen on. Or at least one of them in general. So, had to do a little bit of my own, research on these. But the first question that I did, I put up a poll on my Instagram, just asking if anybody had some, peptides and things they wanted us to go over. And one of them was GHK-Cu, so copper. This is going to be primarily, so the question was injectable versus cream. So a lot of times, this is for skin and hair issues in that regard, like skin issues, hair issues, things like that. So, but it also does have some regenerative properties to it. But like I said, the question was the difference between like the injectable versus the cream. So that's the first thing I want to go over before I go into like what it does and kind of this will kind of answer that, but what it does and how it's used. I don't think this is going to be something that a lot of people necessarily need or are going to reach for unless it's like a pretty specific issue. But as always with injections, we're talking better absorption. For this specifically, it's going to help. Like I said, it does have regenerative properties, so it's going to do that systematically, right? So we're not going to have, we're going to have some organ regen benefits. It's going to be better for joint and tendon healing. I've seen some studies that, like, I looked at a couple that did mention had some possible like metabolic improvement like capabilities, which is always good. But again, that's something that I haven't dug too deep into that. It's not something that I would use. There's many other things that I would use for that before I used this. So it's not something that I would reach for first. But then with the injection stuff, some of like the negative stuff is just going to be, it's going to be a little bit more expensive. It's going to involve needles. And I have heard that the injection is really painful, like pretty bad. So if you're using it for like skin repair, hair growth, scar healing, these kinds of things, in my opinion, I'm going to reach for the cream because it's not going to, it might not be, the absorption might not be as good, but if you're using it for specific things, which through what I looked through, that's mainly what we're looking for. So like if you had, like a, scarring or something somewhere, skin issue like that you wanted to repair and kind of refurbish that skin, you probably have specific areas that you want to do that in. So spot injecting versus cream, like the risk, not risk, but the benefits to the cons of injection versus cream, I'm probably going to go cream every single time, especially for, the issues that this takes care of isn't things that we see in like necessarily like bodybuilders or people who are pinning themselves all the time. This might be something that's used for, just like your everyday like lifestyle client, and you don't really want to make them pin something if they don't have to here. So that would be, kind of my initial thing. That really the only potential like immediate side effect is that like injection pain, localized around like the injection site, which I know you've probably had it. I've had it tons. Like injection pain is not fun. Especially when it's like the GHK from people I've talked to and the things that I've seen is like a pain, like a burning pain almost. Like, have you ever gotten like a tetanus shot or something?
Me?
Yeah.
See, I don't know who I don't know who I thought you were talking to right there.
I don't either. You're the only one here.
Yeah. Well, it just seems like you're talking to like a crowd, so I'm just sitting here listening. Like, yeah, that's right, that's good.
Yeah.
Yeah. Oh, of course. Yeah. I've gotten a tetanus.
You know how it like burns and like those are like are painful. That's what it sounds like. This is.
There's been no worse pain in my life than when I had to get injections in my scalp. When I had to get anesthesia in my scalp.
Yeah,
so
right,
I know exactly what you're talking about.
Yeah.
Yeah.
That's a pain I don't want to avoid. So, like I said, this is going to be one of those ones
don't want to avoid.
No, that I want to avoid. Did I say I don't want to avoid?
Yeah,
I do want to avoid that as much as possible.
I absolutely do.
I absolutely do.
Would it be used for things like eczema?
It could, yeah. Yeah,
okay.
It could be.
Okay. Because that would be something that a lot of people have like issues with. Like if it would help with that, that's awesome.
Yeah. So that's what I'm saying. Like that's the cream just seems much more beneficial in that regard. Like the pros of injection aren't good enough for that kind of thing. Now again, like I said, it does have like if you inject, it's going to have. It's almost like a BPC to where like when you inject that, it's going to have some systemic effects.
Yeah.
Yeah. So there's that. It stimulates collagen production as well. So that's obviously going to be great for skin, hair repair, which I'm also thinking about that because of you.
Is it beneficial for like wrinkles?
Yes, that's another big one as well.
That type of thing?
Yes. Yeah. So has that, and it can also enhance like wound healing as well.
Really?
Yeah. So yeah. I mean, like you said, can reduce lines and wrinkles and things.
Typically, I would be against topical things like that.
Usually.
Typically. I'd be like, no, just take the injection. The injection's better because it gets to your bloodstream faster. Usually gets to the issue area faster. And if it does have systemic healing properties, then maybe the injection is worth it. But it depends on how much that healing actually is. Like if it's not doing a significant percentage and the pain, the PIP, the post-injection pain is like too much, then yeah, just go with the cream.
That's what I'm saying.
Especially if it's just one area.
Yeah.
You know what I mean? If you said like it's a scar, yeah, absolutely. Just cream on that one scar. But if you have like a thing like eczema where you're having skin patches like in your arm, in your elbows, your knee pits, like wherever people get eczema all over the place. Like if you're having that issue, then just do the injection because then you don't have to worry about trying to hit all of those places with the cream.
Yeah,
that'd be the only time that I would say go injection.
I will say again, and this is the thing that it really depends on what you're using it for because it does have some pretty potent antioxidant and like anti-inflammatory effects as well. So if you're using it for that, or like I said, it does have properties that help like organ regen. If we're looking at it for that, injection is probably going to be your best. You're not going to get the like best effects probably from the cream if you're using it for that. But if you're like, it does stimulate like follicle growth, or like I said, like we talk about wrinkles, scarring. If you're using it for skin issues, I think the cream is the best. But if you're using it for anything internal, obviously injection is going to be the way to go with that. Probably 9 times out of 10. But biggest thing with that is just the regenerative properties. So anti-inflammatory, antioxidant, things like that.
Any negative side effects?
So that's what I was going to say. Like these, and this is to, say this to, before we talk about the rest of the peptides.
I was about to say, yeah, this is all peptides.
I said this at the beginning. A lot of these are being studied recently. So there isn't a lot of like long-term research, like years and years and years on it. So that is where we run into the issues. But like immediate side effects is really just like the worst one I saw was like that injection pain.
this is why I have an issue with a lot of these types of
Right.
compounds, peptides, SARMs, whatever the case is. People ask me all the time about different SARMs and different peptides. And I'm like, listen, guys,
Yeah.
I can tell you what we think we know, but in 15 years, you're going to know way more, because you're going to have people who have been on it for 15 years and who have either seen great benefits, or they're going to have really bad side effects. So this is my issue with a lot of that stuff is we don't know. We can't know. So there are things like even like BPC and TB that are pretty safe, but then there are some that we just don't know. So that's the reason I always go back to, like, when people are like, oh, should I take this instead of testosterone? I don't want to inject, so let me take SARMs. It's like, why are you doing that? I get the not wanting to inject yourself, but eventually you're going to have to anyways, because the SARMs are going to shut you down and you're going to have to be on TRT for the rest of your life. So you're dumb not to just start testosterone in the first place. Second thing is, they've worked, like we've researched testosterone now for 80 plus years.
Years.
Decades. We have so many studies. And then third, we know every single health benefit and we know every single health negative. We know them. You can prevent them. With some of these that have only been out for a few years, you don't know the negative side effects because they haven't been out long enough for you to even materialize them yet. You know what I mean? We don't know if it affects different things.
Peptides specifically are a lot less.
They're a lot less.
Like you're not getting any side effects that you're getting from like tren with GHK. Like that's not going to happen, right?
Yes.
So a lot of these aren't affecting
but I guarantee you,
like
in 10 years, you're going to see some research that says BPC causes cancer because this person who took it for a long time got cancer. It was the same thing with like Cardarine back in the day. Do you remember Cardarine? It's one of those like SARM, whatever type of thing. It's not really a SARM, but like people were like, oh, well, the rats were getting cancer. It's like, yeah, that's because they were dosed 300 times a normal human dose.
That's another thing you got to think about too.
For months straight, you know what I mean.
The drug does not make the poison; the dose does.
No, correct. So yeah, we're going to go over some kind of protocols. Again, we're not medical professionals. We're just kind of guys who like to research this. Yeah, we're not medical professionals, so don't take this advice and actually use it. But we're going to give you some protocols that we follow. And that people that we know have followed in the past, and maybe even possibly people in the future that we help will follow. But
that's the thing with peptides, steroids, anything like that. Like we are kind of the forefront of that because doctors don't want to touch this shit, and if it really works really well, they don't want to touch this shit. So it's one of those things where we kind of have to be okay with being in the field of guess and check, for lack of a better term. We are the research. Yeah, we are the research. So. It's one of those things where you always want to be on the safe side.
It has to be that way. It's unfortunate that it has to be that way.
But somebody's got to do it at
somebody's got to do it. Might as well be me.
Somebody's got to do it. Yeah. But yeah, so that's kind of my take for you who asked this question on the GHK. If you're using this in a client, because I do know that the person that asked this is a coach. If you're using this in a client, if you're using it for antioxidant properties, if you're using it for anything like systematically, probably go with the injection. If you're going for anything like joint or anything like that's internal, probably go with the injection, as you're going to have better absorption and better systematic effects. But if you're doing it for follicle stimulation, scarring, wrinkles, like the skin impairments, and I would probably go with the cream. It's probably going to be much easier for your person.
And I want to say this too. I would, if you're using it for systemic inflammation and things like that, there are better compounds.
There are, which we will go over.
Yeah, we're going to go over those, but there are better compounds. So unless they're having an on the skin, like on the surface level issue, then I would just go with the cream.
That's why this question kind of threw me through a loop, because I was like, this isn't even
more detail.
Well, it's not even that. It's just I don't hear this one.
You don't hear it thrown around
utilized a ton.
No, I before you said it, I had never heard it before. So
yeah. So it is what it is. But Yeah. Another question we had was like your best the best ones for there was like muscle building, fat loss, things like that. But for muscle building, um, what would you say is your go tos if we're talking about just peptides in
Just
general?
for muscle building, hold on, let me go down and look at my notes because I want to make sure I get this right. um, a couple that I for sure prefer are going to be MK677, because just the way that it reacts to your lean mass and
Hmm.
the things that it does to your body to make you produce more, and it's really good for an off season. I'll say it like that.
Yeah.
It's
Hmm.
fantastic for an off season. I don't know that I would use it during a cut as much, unless somebody is just really having an issue with eating. But even then, like, we're going to cut you down to enough to where you're going to get hungry. Um, but I mean, it increases lean muscle mass, it reduces fat mass, improves sleep, which are all just great things for anything building
Sleep's a
muscle.
huge one. Hmm.
Huge, huge. And it's just because it boosts like your growth hormone and your IGF-1 levels. Like, that's the
And that's the
main
thing
thing that it does.
with these, especially the muscle building ones that we're going to talk about. That is none of these are going to directly do too much. This is all
Mm-hmm.
like um,
And
it's going to help everything else.
MK677,
That's going
yeah.
to help your recovery, help your sleep, all the things that that you need to build
Mm-hmm.
muscle. It's going to
Mm-hmm.
improve on. So
Yeah, it's not necessarily
you're going to get
acting.
better effects from just taking some tests. We'll just
Yeah,
put it
I was about
that
to
way.
say
But
it's not
yeah,
going to. Yeah, you're not going to take MK677, any of these things. You're not going to take any of these things to start building massive, massive amounts of muscle.
yeah,
You're not. But these are going to. They're going to do two things. One, they're either going to help the carrier. So, like, let's say you have testosterone in, it's going to make sure that the testosterone gets to where it needs to be and
hmm,
interacts with the androgens that it needs to interact with. Once it does that, that's going to cause you to be able to build muscle faster.
yeah,
That's what it's doing. Um, MK677, by the way, is not necessarily a peptide. It's more like a growth
yeah. No.
hormone secretagogue.
Hmm.
Some of these peptides and SARMs and all of these like things are in a weird class of their own, but we're just kind of
Yeah.
throwing them in. SARMs we're not going to really talk about, but I would actually probably throw MK677 more in the SARM category than I would in the
It could be.
peptide
Hmm.
category. But
Yeah.
we're just going to talk about it because a lot of people throw MK in with the peptide talk.
Hmm.
But I love MK in a off season setting. I also love it in a setting where client is struggling with food. So I have had a couple of clients who have been really, really skinny their whole life, had never been able to add a ton of muscle, never been fat, never been even even close to being overweight at all. Just always skinny. And you put them on some MK677 with a little bit of a testosterone base, and man, their weight just skyrocketed. I took one guy from 145 pounds at 5'10" ish, 5'11" to 175 pounds. And that was over a year's time. And he didn't get fat. He was
That's pretty
very
decent.
muscular, pretty deep, 30
Yeah.
pounds. I mean, 30 pounds is 30 pounds. And we didn't run anything crazy. We weren't running any crazy doses of anything.
You don't need to.
And you don't have to, as long as if you can eat food and train hard, that's all you need to do, right? For most people. So, but yeah, for as far as muscle building, that's the one that I would use. And other ones would be like, I mean, BPC at
Anything.
157. I mean, it's so weird because these things, like we said earlier, they're not muscle builders per se. They're not going to just react and build muscle. MK is a little bit different outside of those, but the rest of them, they don't really do that. That's not their
Any
MOA. That's not their mechanism of action.
anything with that has to do with GH, secretion is going
Mm-hmm.
to help that. So like MK677, which you'll also probably hear, ibutamorin, I think is how you say it. Ibutamorin.
Ipamorelin's another one.
Well, no, the
G.
MK677.
Oh yeah, yeah. They're
The
interchangeable. Yeah,
name
yeah.
for it. The
Yeah.
name for it is
Yes.
ibutamorin, like the
Yes.
scientific name or whatever.
But I
But
mean, I
this
have other
obviously, like
ones
you
that
said,
are. Yeah, there are other ones on here that are growth hormone. CJC is one. Ipamorelin, GHRP. Let's see here. Those are the ones that I have on my list that are like some of the more well known
yeah.
peptides. that are great for growth hormone stimulation. And again, growth hormone does not build muscle. Like that's not what's building your muscle, right? It's just helping the system, your entire system, with the process of protein synthesis, which is building muscle. It's going to help you sleep better. It's going to help you recover better. It's going to help with some of these things, have like blood flow and some, reduce inflammation. All of these things are going to be necessary for building muscle, and they're just going to help improve. So let's say your testosterone is helping you build 3 pounds of muscle a year. This maybe could bump that up to 4. You know what I mean?
Well,
that's kind of
GH is one of those things too that's like it enhances everything else that you do.
everything.
So the food that you eat, the recovery that you have, all that kind of stuff. And I know for me, when I put in MK, the two things that I did notice was heavily was better sleep and my hunger skyrocketed as well. And I'm someone who
that's the reason I always say in the off season.
Yeah, and this is something that could be beneficial for some of you guys, because for me, I am not a person. I hate eating, bro. I hate it. I hate eating. I hate eating as much as I have to, and I don't even have to eat that much. Like I've eaten upwards of 5,500 calories before. I'm eating 4,000. I still don't like it. So, but for me, like when I sit down to eat now, even if it's the last thing I want to do, like it will be gone like that, and that didn't used to be the case. So that was a huge benefit for me. It's also going to increase your IGF-1, which again, that's another peptide supplement, whatever that will interact with that GH. IGF-1 is obviously a huge one that at least I hear a ton about.
Oh yeah.
But again,
well, you'll hear doctors who aren't talking about bodybuilders, like just in your normal population, just like regular lifestyle people. IGF-1 plays a huge factor in because you can look at IGF-1 and that's probably going to tell you how much muscle mass a person has, and it's been shown in multiple studies that the more muscle mass you have, the more lean muscle mass that you have, the better quality and the length of life you're going to have.
Yeah.
Like it's been shown. It doesn't matter like it's been shown across different races, different age groups, different ethnicity, all this stuff. It's been shown that the more muscle mass that you have, the more lean muscle mass that you have, the longer you're going to live, the better your life is going to be. Your life expectancy goes up dramatically. So IGF-1 plays a huge factor in that. And so like, that's why you hear doctors who aren't even talking about building muscle necessarily for bodybuilding or showing off or whatever.
Yeah.
They just talk about IGF-1 a lot because IGF-1 is something that anybody, it doesn't matter if you're male, female, is going to be beneficial for your body.
Yeah.
Across the board.
I'm gonna go over that one in specific, like a little bit more in depth here in a second. Yeah. But wrapping up for the MK, just for you guys, so like like we said, it's going to help your appetite. It's going to help your recovery. It's going to help your muscle, your lean body mass. It can increase that IGF-1 like in as little as like a couple weeks. So it's very fast acting. It's going to greatly improve your appetite. So this is huge for everybody, but especially those hard gainers like we talked about. Now, for me, I know like dosage wise, I know a lot of people like to do like they'll have 25 milligram caps, right? And they'll take that before bed. You want that to, improve that because that growth hormone is releasing while you sleep, right? So you're improving that while you sleep, which is fine. We can do that before bed. But what I like to do, because you're going to have times in the day where your growth hormone secretion is lower and where it's higher. So I know some people will stack that to where, hey, when your growth hormone is supposedly higher, they'll put it on top of that to even boost that. But for me, I like that level playing field throughout the day. So what I've been doing even personally is splitting that up. So where I'll do, 6.5 or 6, 6.25 every like 3 times a day, right? Milligrams 3 times a day. So I'll do, for me personally, and this isn't, what you guys should exactly do, but for me, I'll take my 6.25 milligrams at 9 a.m. I'll do it again like midday, like 3 p.m. And then I'll do it again at night at 9 p.m. So we have those spikes in that GH kind of all day to kind of level you out instead of having it all kind of at once. That'll help obviously the absorption and the use of it as well. So that's something that I do like to do, is to split it up throughout the day, more often than not, and
yeah, I mean,
that's probably going to help you. It's kind of like,
everything that
just how I do my test. I do that, multiple every other day instead of twice a week. So,
yeah, I mean, it's one of those things where if you're the type of person that can't remember or has a busy schedule to where you're going to not be able to do it every single, day at the same time over and over, just take 25 milligrams at the end of the day. You're right before you go to bed. Like,
and
it's not,
to be clear, this is not a injection. This is an oral thing, so it is a
yes,
lot
yeah,
easier to do. Like, you can pop that
correct.
pill while you're at work. You don't want to run into the bathroom and inject necessarily while you're at work. So
no, yeah. So I had a question about MK677 as well, and it was talking about this is a bodybuilder that is a client of mine, and he was asking about MK on a cruise. So when he is not taking like significant amounts of any drug, PD, steroids, whatever. So my thing is in the off season, yeah, I love it. It's gonna help your appetite. It's gonna help with lean muscle mass. It's gonna help, just increase that IGF, and it's gonna keep you. It does aid in fat loss a little bit, so it's gonna keep you a little bit tighter, which is what we want in the off season, guys. Just to be clear, don't get fat in the off season. I'm too fat for my off season right now, and it's
why bro has to do a 30-week prep.
30-week prep. Yep. if I'd have been 15 pounds heavier, it would have been fine. So yeah, guys, don't get fat in your off season. Yeah, that's what I meant.
If you'd have been 15 pounds heavier, it'd have been a lot worse.
we just keep messing up. Oh, dude, it'd be way worse. I'd be looking like a balloon right now. The other question, go ahead if you had something else to add to that.
No, I was just going to say, because you mentioned something earlier that I just thought about with the IGF, like the MK also has like anti-aging potential, just because, like you said, you elevate that GH and that IGF, and you said the doctors were implicating longer lifespans through that. So that's kind of how it will give you those benefits. Improve skin, like your skin, like elasticity, reduced wrinkles, things like that. You're just going to be a little bit healthier through that, improved GH and IGF-1 as well.
Yes, sir. My other question was views on the use of peptides like BPC 157 and TB 500 on and off cycle for full recovery. And I'm assuming he was saying body, but he said bod. Absolutely. That is what BPC and TB 500 are there for. They're there for recovery. They're there for, and the thing is, you can even use these when you're trying to build muscle. Not just, you don't have to wait for an injury to use these things, because they're great for
these are going to be,
they're great for, so I read this when I was first doing research on BPC and TB 500. I've taken it before. I had a tennis elbow or what's it called? Where you had like elbow bursitis. Like I had that right in the tip of your elbow. And a lot of bodybuilders, as they get older, because they're trying to press weight, that's usually what happens. They get that like tennis elbow or elbow bursitis. So I was just struggling with it. I couldn't do any type of push downs. I couldn't do any type of workouts. And then after that, I got a shoulder injury. I was bench pressing and got a shoulder injury. So I was like, all right, I got to do something about this. I can't even open a door, like a regular door, like that's behind me. I can't even push the door open. My shoulder was hurting so bad.
And that's all. Everything is so connected. Like when you have an elbow injury, that creates overcompensation through other body parts on your body, and then because your shoulders are overcomplicating for your lack of ability through elbow mobility, then your shoulder gets overworked, and then you hurt your shoulder. So these injuries, and take it from both of us who have let injuries go and create more issues, just take care of it immediately. The second you get a little nick or whatever, just do whatever you need to do to take care of it.
And if you have a coach, let your coach know, because we can adjust your training around that. That too. Just to be clear. So but as far as for using those things, I mean, man, BPC is it worked. It worked so fast too. I mean, it took 2 weeks. 2 weeks, and I was back in the gym doing 315 bench press and having no issues.
So,
but
go ahead. Did you use Did you use BPC only for that?
No. I did BPC and TB500. The reason I did that was when I was doing research, everybody that I came across that was talking about this always paired BPC and TB500 together.
Yes.
And I was like, well, why is that? Well, and you can correct me on this if I'm wrong, but this is what I had done research on, and I had found multiple resources saying this. So what I believe that it does is it will create new blood vessels that go to that area. So the way that you heal a body part in your body naturally without getting surgery and stuff like that is through blood flow. Blood flow to that area is essential. That's the reason you massage it. That's the reason that when you get the gun on it, you put pressure on it, stuff like that, is because that is targeting your it's making blood flow go to that area. It's making it warmer. It's making it, whatever.
Yeah. So that's.
Go ahead.
I was going to say that the BPC is the reason that I hear or that I want both of those together. Is BPC is going to bring the blood flow, the new blood vessels, those kinds of things, which is going to reduce the inflammation. So your BPC is going to be, and it's actually something that correct me if I'm wrong, it's found in our gut, I believe.
So it does
that form of it.
Mm-hmm. And so it's really good for the gut. By the way,
it is.
BPC
it is very
extremely good for gut health. Yep.
Mm-hmm. So it does those two things, and it reduces that inflammation. So we're attacking it from two sides. The BPC is going to allow that blood flow to increase, and it's going to decrease your inflammation. If you have inflammation, if you have chronic inflammation, good luck fixing any of your problems. So that will attack it from there. The TB enhances is what the tissue regeneration and the cell, like the cellular migration comes from. So without the TB or without the BPC, the TB can't work well. Without the TB, you're just improving things and creating an environment for recovery, and then not giving it the tools to recover. So even I just bought a new bottle from Amino Asylum, code Big Lad, I think, right?
Yeah, shout out to Amino Asylum. Yeah, guys. So real quick, I'll just go ahead and give myself a shout out.
We'll put it in
the link. But I have a code with a company called Amino Asylum. I've been using them for like 3 years. It's where I get all of my peptides. Now I don't use some of these peptides that are on this list are not going to be on Amino Asylum. You can find them at other places, but like TB500, BPC, even MK677, a lot of those things are the main ones are going to be there. And they have the injectable and they have the nasal spray. Code Big Lad saves you, I think, 10%. So yeah, use code Big Lad. AminoAsylum.com. I appreciate it.
I got one off of there recently, and they only have the vial that is TB plus BPC now. At least when I looked on there.
No, I have some sitting in there that I just ordered, and they're separate.
How long ago was that?
I literally ordered it 2 weeks ago.
That's weird because I looked on there like.
When I
ordered mine, that was like a couple weeks ago.
They sell out fast. So fast.
Yeah.
If you want to get some, make sure you get some and stock up on it, honestly, because it goes.
It runs out pretty quick. That's another thing is this isn't a, you inject it once or you nasal spray it once and you're good. Like this is everything you supplement supplements and peptide wise are going to be a consistency and compounding kind of thing. Especially with things like, like the BPC. So like for the BPC, stimulates collagen synthesis, new blood vessels, tissue regeneration. That's not going to happen overnight. Right. But you're going to get things like we talked about, like the tendon and ligament repair. It heals gut. I don't want to say heals gut issues. It does not heal gut issues, but it can
promotes
greatly
healthy
help.
gut.
Yes. And the biggest one is going to be reduction in inflammation and pain with the BPC.
Just to be clear, these two BPC and TB500, they shine when it comes to ligament, tendon injuries.
They do.
Those two things, I'm telling you, if you have a strained pec, a messed up shoulder, messed up elbow, whatever the case is, like I was having a weird pain in my tendon that ran from my bicep to my forearm. where I would get pain every single time. It felt like it was going to pop. And it was really in my forearm, like my lower, but it was just where those two attached. And I started taking that BPC. I mean, like
Clears
that, it was
up.
gone. It
Yeah.
was awesome. And you know, for the recovery protocol that I have written down, usually you take anywhere from 250 to 500 milligrams or
500.
micrograms, I'm sorry,
Mhm.
of each. And you can
Yeah.
do them up to 2 times a day for like
I was gonna
6
say, yeah.
weeks.
I like to split everything up.
Yeah.
Most
It's
of stuff.
better. It's better to do that anyways. Now for me, I only, when I first started doing it, I only did it 1 time a day and it worked just fine.
So did I. I will say I
Yeah.
did that as well, and I used it for a back injury, and it helped a lot. And I only did it
Mm-hmm.
once a day. So
and they say this, but I tested a little bit and it didn't really matter that much. But the closer you can inject it into the muscle of the tendon that is, there's probably not that much. But if let's say you're
I don't
having
know.
a bicep issue, you can it's easy, and you just do it with a little insulin needle. Those insulin needles are so small, you just go right into it. It's still going to go
one of those
systemic.
in my eyeball and not feel it. I swear to God,
not feel it at all.
I swear,
you can.
Those needles are literally like this big.
They're so awesome. They're so awesome.
It's subcutaneous, so you don't have to get it intramuscular. So
Correct.
you don't need you just need it to get below your skin. That's it, and it's gonna go throughout your system and do its work. But
it's always going to be systemic. Just to be clear, it's always going to be systemic. So it's going to go throughout your entire body. But the closer you get it to that, it's the blood flow is going to go right there. To me, it makes more sense if you can get it closer to the injury.
Yeah, everybody I ask is the same as I am. It's number one between the injection and the nasal spray. I'm always going injection because if I can, because I don't have any. Even from what I've looked up, they say the nasal spray works just as good. Personally, I'm not going to. I know that the injection works really well, so I'm just going to stick to that side. But then with the systematic stuff, everybody that I talk to is like they say the same thing that I think. It's like, could there be some benefits of doing it spot injecting it? So like I had a back injury and I spot injected it where my back hurt. Is there enough of a, if you are someone who, like, I had to have Kaylee do that for me. I couldn't reach the spot on my back myself. So if that's the case, you're going to get the effects. But again, it's a compounded consistency thing. So no matter what, you're going to end up getting the effects. Whether it helps quicker or not, honestly, that's an area that I don't have a definite answer for.
Well, I mean, like for me,
people that I've talked to, they don't either.
I had gone with my injury for months. I mean, it had been months. So it had been way over 6 or 8 weeks. So even if it heals in 6 to 8 weeks, that's still way better than walking around with an injury for the next 2 years or forever, possibly. Yeah. So,
but yeah, that's the BPC. The TB, again, that's going to be the other half of what you want to have. So this promotes, like, again, cell migration, muscle recovery, tissue healing, which is going to be the repair of whatever injury you have. But you can get other things like reduce scar tissue, enhanced soft tissue, like repair. So your tendons, your ligaments, like we talked about, improve muscle endurance, stamina.
I was about to say,
wounds will heal faster. Yeah, it just, again, it's boosting all the things that your body already wants to do. It's just
making it function better. It's just so okay. Think about it like this. To me, both of these drugs really are a lot like insulin. So your body naturally produces insulin, right? But people who are diabetic, that insulin is either completely gone or it is very, very down regulated. So in other words, their blood sugar does not get regulated. What these two drugs are doing is they're doing almost the same thing for your healing process and for inflammation that the insulin is doing for your blood glucose, for your blood sugar. Right? It's going in and it's making your system that's already probably overworked because you are training so much. Your body is probably constantly inflamed. If you're not taking care of your body properly with nutrition and even some of these other supplements that are going to help with inflammation and stress and stuff like that, sleep, like your body's not functioning properly. These things are going to go in and make sure that at least your healing system and your anti-inflammatory system and your gut health and things like that are functioning properly, are functioning at least to the level that they should be already. But in most cases, they're going to even increase that above what your body would naturally do.
Well,
So
I
that's
think
why
about
a
it
lot of places are. That's the reason a lot of these places won't let you run TB and BPC, because it is performance enhancing, even though it's
yeah.
not really enhancing your performance. It's just making you recover faster.
When I think about these things too, like peptides like this, steroids like or things like testosterone, like your body, number one, wants these things. It's not, we're not putting it in something that your body doesn't want. And number two, like testosterone is bioavailable. Your body knows exactly what to do with it. It knows exactly, it's already using it itself. It just might not have enough. So you're giving it a little
Right.
extra help. So like these things, that's why they work so well and why they're so safe, because a lot of what we do in the bodybuilding world is going against what our body wants us to do. Putting on a bunch of extra muscle, your body doesn't want that. Putting in things like tren and all these different drugs, your body doesn't want those, are like can be harmful to your body. Things like this, testosterone, insulin, like your body already knows how to use these, what it's going to use it for, and it wants them. So things like this are going to be very beneficial to you no matter what. I think you had a question of like when is the best time to use it? What was the question that you had?
Oh, that was about MK, but oh, are you talking about the BPC? Yeah, so
BPC and
they're
TB.
saying like, yeah, they're saying should you use it or like when? Let me go read it again. I think it was like
I say you could use it all you fucking year round.
Yeah,
I mean,
it's on and off cycle for full recovery. Yeah, that's the thing with these. That's the cool thing about these is they're not shutting your system down. They're doing nothing to harm your system. They're not having any negative side effects. They're only either doing nothing or they are improving what your body is already trying to do. Your body wants to heal itself. Your body doesn't want to be in pain.
Yeah.
If your body's in pain, it's telling you, "Hey, I don't like this."
Yeah.
So if your arm is hurting, it's hurting for a reason. So hey, let's try and fix that reason real quick. And that's something that these compounds, specifically TB and BPC, are going to do.
Yeah. Yeah. So those would be the couple, we talked about doses, how they work, uses. Those would be what I would use for recovery. Obviously, we talked about our couple that we would use for like muscle building purposes. So I want to touch on, lastly, and there's probably a whole nother peptide episode that we can do because I do have a ton to talk about. But
I know
I want to touch on the best couple for kind of each section.
Okay.
So before we wrap it up, I want to go through fat loss ones as well. So I know I have my couple that are SLU PP332 and then 5-amino 1-MQ. Those are molecules, not necessarily peptides, but they can kind of be in this category. But I know you mentioned CJC earlier as well, and I know that can have some good fat loss effects. So I'll let you kind of go through that one, and then I'll go through the other two.
So this is like my fat loss, body recomp / anti-aging. It's going to basically be burning fat while preserving muscle and like improving recovery. So the stack would be CJC, and then ipamorelin, which I haven't talked about yet, but I'll give you a brief summary on it real quick. I have it in my notes. Let me look for it. So it is a growth hormone release. That's like what its main function is to do. It's going to boost natural GH production, improves recovery and sleep, enhances fat loss and lean muscle development, minimizes side effects compared to other GH peptides, which is nice. So and the what it's talking about there as far as the negative side effects would be things like water retention, gut issues, because especially when you take GH specifically, you'll have that gut. That's the reason you see these guys with huge fat round bellies, even though they're
because it will grow. You will grow everything
if you're not all your organs.
If you're not careful, you don't get to pick and choose.
Correct.
You don't get to choose like, hey, I want this to only grow my chest. So you got to be real careful with anything GH. And before you continue with that, like another big side effect of anything GH involved is going to be like those, like you hear people on GH, like I'm sure you'll probably, we talked to Matthias about this. I'm sure you'll see this when you get on GH. The tingly fingers. So you have that, like in carpal tunnel syndrome, we have a nerve. I think it's the median nerve.
Medial.
I'll have to it's.
I think it's medial. The medial nerve, if that's what you're talking about.
It runs through, that's why people who get that carpal tunnel syndrome and that really bad arthritis and stuff, it affects that. It has those like joint issues. It has the water retention. So if you do like feel those things, just make sure you are careful about your dosages and things. Pull it back if you need to. But
yep. So another one, and this is kind of going back to one of the questions that I had. So we have CJC and ipamorelin. Dosage wise, you would do like 100 micrograms a day or 2 times a day for each, morning and pre-bed. You'd want to do them fasted for these two. You want to do them when you when you wake up in the morning before you eat anything, and then pre-bed. This would be like after you've had your last meal, a few hours, and then you take it right before you go to bed. So the purpose for these is it stimulates GH release for fat loss. So if you didn't know, growth hormone is a fantastic fat loss compound. It basically it helps with fat oxidation. So it moves fat cells, fatty acids around the bloodstream to get used in different activities for the body. Okay, which is the main point for fat loss. Okay, the way that you lose fat is you use fat. Okay, you burn fat. That's why burning fat. That's what that's called. That's what the GH is going to help with. And it also is going to be really great for like muscle prevention, or I'm sorry, preservation. So muscle loss prevention. So those two, that's what those two are going to be used for. The next one, again, this is all stacked together, would be MK677. I know that somebody was asking about this for like fat loss, or using it in the off season. So you would take 12.5 to 25 milligrams daily. And this would be, for me, I'm just going to take it once pre-bed. I know you were talking about breaking it up twice a day. That's fine. If you want to do that, that's totally cool with me. And it also depends on what your dose is, or like what's your not dose, what the milligram per pill you get. If you're getting a 25 milligram pill, it sucks to cut it in half. If you have one of the capsules, you can't really cut it in half.
Capsules, you can't cut those at all.
No, you can't. So it's like you might as well just do it once a day. Again, purpose is just release. It increases GH and IGF-1, and it just aids in fat loss and muscle retention. The last one is kind of optional, and this is more for like gut health and recovery. And this is something that I would still use, even especially like I'm about to go on prep, and I have BPC and TB in my drawer in there. So it's going to be 250 micrograms per day. So you can lower the dose a little bit. That's twice a day. Sorry, not per day, twice a day. So it'd be 500 micrograms per day. Reduces inflammation. It's going to improve your recovery. And it's really good for like when you're in a caloric deficit, because that's usually when injuries happen. It's either going to be when you're really, really big and you're like pressing a bunch of weight, or it's when you're 6 weeks out and you're trying to move as much weight as possible still. You're tired, your body's exhausted, you're under a lot of stress. You can take this BPC, and it's going to help with just recovery in general. The length that I would run these would be about 12 weeks. Some of them you can run a little bit shorter, like BPC could run for 6 weeks and be fine. You can extend it to 16 weeks for like, if you're doing a nice prep or something like that, you can do that. The thing is though, guys, all of these things work simultaneously with things that you should already be doing. So like your diet. Your diet needs to be on point. You're not going to lose body fat if you're just eating like crap and then taking these things. That's not how this works. It's not how any drugs work. Steroids, I don't care how much tren you take. I don't care how much clean you take. If you're eating like shit every single day, all day long, you're not going to lose body fat. You're not. Sleep is huge, guys. Sleep is huge. These things will help you sleep better, get better sleep, which is going to help your recovery process, which is going to release more GH, which is going to help you grow better. Guys, sleep. Get your 8 hours a night in, okay? Hydration and electrolytes. Make sure that you have all of this stuff in there, because some of these things can cause, like headaches, or you can feel tired, especially like MK. That's one of the side effects is just like
dizziness.
Headaches.
Dude,
dizziness.
Do you remember when I took that? I still don't know if it was the MK or if it was that shit that I bought. Remember when I took that stuff?
Mm-hmm. I remember.
Because, dude, when I took that MK that first time, but I really do think that it was. So the issue was I got this basically injectable pre-workout. It was from Amino Asylum, I believe. But I took that and I took MK. I took both of those things. I took them for the first time ever. And I was in the gym and I just got that dizzy, like blood sugar crash feeling almost.
Dude, you know what I bet? I bet that was. how much research did you do into the pre-workout stuff? Did it have DMAA
Zero.
in it?
I don't know.
Okay.
I remember I sent it to Justin, and he was like, let's try it out. See what happens. And I said, it's still in there. I ain't used a drop more of that shit. And
you need to look into it. You need to look into it and see what it has in it.
Yeah.
Because do you remember the old, I think it was like old Jack or Jack 3D pre-workout?
DMAA or whatever.
It had DMAA in it, which is basically freaking one molecule away from being
crack.
Methamphetamine. Yeah, no, it's methamphetamine, dude.
Yeah.
And the thing is like, I remember taking that stuff and I was like, man, I'm having the best workout of my life. And then all of a sudden, it's like you're outside of your body, and it is the weirdest. Yeah, you just crash so hard. And I remember I was over at the trash can, like going to throw up. And I think what it does is it tanks your blood sugar too.
Yeah.
It makes your blood sugar tank. So you just feel like you're about to just pass out and throw up all at the same time.
That was the thing. Kaylee was like, you got to eat something. And you know me. I was like, bro, I'm not fucking, I can't have this Anabar, bro, because that's not on my meal plan.
Yep.
She was like, I literally felt like I was going to die. So I ate that. I was back brand
new.
So
that's probably what happened is your blood sugar dropped from both of those things, because that's another thing.
It probably was a mix. Yeah.
GH, I think GH has an effect on insulin, I'm sorry, not on insulin, on your blood sugar throughout your body.
Yeah,
I think it has
affects the IGF-1. It's going to have that effect. Yeah,
yes, and so it affects your blood sugar. So that maybe is why you crashed, and it could have been a mix of both. It could have been a mix of you took too much of that stuff, and maybe it did have some of that DMA in it, and then you took the MK, which is going to affect your IGF-1, which is going to crash your blood.
This is why we say be careful, and we're the fucking guinea pigs, because this kind of stuff happens, and then don't do that again.
Now don't take the freaking weird stuff off Amino Asylum that says pre-workout.
Absolutely not. It had some, I don't know, some crazy name, but I won't be using that again. I don't need that. I don't even take regular pre-workout. I only did it because I got that for free, so I just didn't want to waste something for free.
I'm wondering why they're giving it away for free.
No, because it was a deal. Remember, my guy had like a.
I forgot. I thought you got it from Amino.
No, I found out he was partnered with Amino because he stopped doing BPC and stuff, and I was like, "Hey, why don't you have that?" And he was like, "I don't work with Amino anymore." So that was why.
That's for recovery. That would be my stack. That would be the stack that I go with, because that's just, it covers all of your bases right there.
Yeah.
So
the few, so there's
a couple that fat loss, not recovery.
Yeah. I have a couple that I'm personally using right now that I love, but then there's one that I have personally not used, but I know is very, as long as you use it correctly. Now there's a couple. There's retatrutide and then there's semaglutide. The one I'll go over is semaglutide, but just because I don't have time to go over retatrutide as well. But again, we'll probably do another one of these, as there is like a whole other half of these that I do want to go through. But semaglutide, this is one that is, talked about a lot nowadays as well. It's your GLP-1 agonist. So basically it's going to largely suppress your appetite. I saw it also slows digestion a bit, which I don't like, but
it attacks your ghrelin too. It affects your ghrelin, which is your hunger hormone. So, and then I think it decreases your because your intestines are kind of like they move. I think it just affects the speed at which that moves.
Yeah, which is fine if you're using this for what it's used for, fat loss. Again, like we talked about with like, hey, dude, if you're depths of a cut or a cut and you have very low food, you probably don't want to use something like MK that's going to skyrocket
boost your
hunger,
boost your appetite. Yeah.
So same thing here, but you're going to get obviously like your extreme appetite control. So you're not going to have, I know even, I can't remember if Justin was saying this about retatrutide or semaglutide, but I know he said the one he used like made him like not hungry like at all, which also could be its own problem. So again, you just got to be careful with how you're reacting to it, how much you're using it.
I have heard it's all dose dependent, by the way.
Of course.
So like the more you take, the less hungry you're going to be. But it's similar. Do you have any friends? I've never tried Adderall, but have you ever had friends that have been on Adderall?
Mm-hmm. Yeah.
Okay. So like it's similar to Adderall. Like when you're on
Yeah.
Adderall, you don't want to eat anything.
Don't
But
want
as
to
soon
eat
as
at
it
all.
wears off, you're like, oh my God, I'm starving. You
But
know what I mean?
Adderall's
So
also one of those one molecule away from being meth too. So
yeah, well, that's what
yeah.
I'm saying. I'm not saying take Adderall, but to
No, I
substitute
know
this,
that, but yeah,
I'm saying like I'm just saying like I think it has a similar effect of
it
where
does.
like
Yeah,
you're not you don't have
your
any
appetite
like
is just trashed.
your brain is not getting the message of like, hey, I'm hungry. It doesn't mean
Mm-hmm.
that you can't eat. Like if you eat, you're
Yeah,
not gonna be like ooh and like throw up. You know,
yeah, no.
it's not like you get a it's not like it shrinks your stomach or like the surgeries do or like a gastric
Mm-hmm.
bypass or whatever. It's not like where you can't eat
You'll
anything.
probably just feel
You
like me
just
all day, every
don't
day.
want to. Yeah, you just don't want to eat anything. You're
I
not
never want
hungry.
to eat anything. Yeah, but yeah.
I
So
have a question for you.
you're
I have a question for you. This is off topic completely, but it's okay because I want to ask you anyways. Do you think that it is wise for coaches like us, if a client is having an issue with eating, to recommend they smoke weed if they can, if it's legal in their state, if it is their job allows it, things like that? Is it worth it? Is it worth it for a client
no,
who is struggling? Okay, that's all I had.
no.
I probably would answer the same way. I just didn't know what your thoughts would be on that.
And not because I don't want to, not because I'm like, oh, I would never, tell someone to
Anti-smoking.
smoke weed.
Yeah.
Yeah, none of that, because we literally prescribe drugs to our clients every day, all day. Weed's probably
Yeah.
the least of their worries of what we're putting in our bodies. But
Right.
it's just because I know that people can't handle it, and I'm not going to be the reason why somebody's life falls apart because I told them that they should smoke a little. There's things that we can put in. I would put in MK before I put in fucking weed. You know what I mean? Because that's not going to be addictive or destroy their life.
I've had a protocol before where a client was already smoking weed because he knew he couldn't eat. And then I was like, okay, well, is it helping? And he said, yes, it helps me to eat. I said, okay, but are you eating enough? No. Okay, let's throw in MK. When I threw in MK plus the weed, he was like, oh, dude, appetite's through the roof. So, I was like, there we go.
So here's my thing.
That's the reason I wanted to ask. That's the reason
it becomes. If we have to, here's my view. If we have to depend on a drug of any kind to perform any normal, should already be happening bodily function, to improve, to help get regulated. So like if your sleep is poor, are we going to use some supplements to fix that? Sure. If your gut health is off, are we going to use some supplements to fix that? Sure. But the goal is always to be able to come off and not need anything, right? So if you're a person who's like, I have to smoke to eat, that becomes a major issue. I don't want anybody needing, because then what happens if, you're okay, let's say we're in prep and you had to travel for prep and you couldn't bring weed with you. So now you can't eat your food because it just becomes more of an issue. And that's something that I'm very lucky that I demolished when I started, because I started bodybuilding. Like I competed for the first time after like a year and a half of being in the gym. That prep, I mentally decided to flip that switch to where I was not going to, like, I didn't cheat on my diet. I would smoke, every night, right? I never binge ate. I never cheated. So I got this large self-control around food. And now, like, dude, when I smoke at night, if I don't have if I still have a meal left or something, it's really hard for me to eat it after I smoke. It's weird. Now I don't like to, smoking makes me to a point where I'm just like, dude, I don't want to get up and make my food. I already don't want to eat in the first place. So I'm in this weird other side of this, which is less of a problem than if I needed it to eat. But again, like I said, I just don't think that I want anybody depending on a drug like that, like a recreational drug, to get things done. Everything we put in should only. I want to be clear.
It would have been. It would be a throw in the kitchen sink at something at that point. It would be, and it would be for somebody who was who physically couldn't. Like I said, like my one client that I have, Hunter, Shout out to Hunter again. This is probably like the third time I've mentioned him on this podcast.
Yeah, that is. Yeah,
he just keeps getting mentioned. But 5'11", 112 pounds, 113 pounds. Like the dude needs to be able to eat. And if he's eating and he's not getting enough, it's like, all right, well, we got to figure something out.
Well, and that's where we had this conversation before we got on here. That's where my brain goes to. Again, we talked about the understanding of what's going on inside. It's like your body should be producing that hormone that's telling you you're hungry, and it's not. We need to figure out why, instead of throwing and I'm not saying like obviously you had other things that you put in, but in a general sense, I'm not going to look at someone like that and be like,
I want to be clear. I didn't do that with him. I'm talking. This was with another client who was already smoking weed, and then was like, I'm still not able to eat enough. Let me. Yeah. Like, okay, well, let me. So that's the reason I wanted to get your opinion on, because they are both drugs. They are both technically illegal drugs in some states. You know what I mean? In some places, in most places in the world,
not for
MK
you,
is illegal.
Lucky bastard.
But I just wanted to know like what your thought process was on that. I would never. That would not be something that I would actually. That would definitely not be a number 1, number 2, number 3 option, but that would be a down the list option, and that would of course not be something I would ever force on someone. It would be something like, hey, do you smoke weed? Do you have the ability to smoke weed? Do you have the money? Do you have blah blah blah? Okay, cool, you do. Let's try that and see if that helps. It'd be something that would be in the off season, but yeah, totally agree. But even then,
like you said, like you said, like he was doing it already, and it still wasn't doing what it needed to do.
Well, that's because
it's not going to fix those issues.
That's what I was going to say. Like it depends on the person too, because like you said, you smoke now, and you're like, I don't even want to eat. Most people, that's the opposite. It's the complete opposite reaction. So that's why it is definitely person dependent.
Well, and that's why I was saying, like, if we look at that situation, it's like, okay, we weren't being able to eat, smoking, still not able to eat. Then you put in something that increased the hormone that was supposed to be there in the first place, and all of a sudden he could eat. So that's where I'm like, okay, I need to find that before, which, like you said, like that's a way down the list kind of thing. We have some things in the front to fix before that. Right. But yeah. Yeah, so semaglutide is going to do all those things: improve insulin sensitivity, decrease your appetite. It's going to be great for obviously like a fat loss phase or protocol, and it's going to help you diet without feeling the depths of the diet as hard as you would before.
It does still create fatigue. So here's the thing. I will say this. I'm sorry, I don't mean to keep cutting you off.
No, you're good. You're good.
But the semaglutide, any of those, Ozempic, tirzepatide, all of those kind of GLP-1, whatever,
agonists.
They're suppressing your appetite, so you're not getting the nutrients that your body needs. So you're probably going to feel tired. You're probably not going to feel motivated to work out. Your brain function may even decrease, especially if you take it for a long time. There are other really bad negative side effects that some people have just now started to get, like osteoporosis, bone mineral density degeneration. Like things like that are going to be what can have a really long-term negative effect. Like if they are, and then you can even, like, there's been studies that have shown, and it's so funny because there are studies that show these things, and it's usually for people who don't train.
Yeah.
But there's a study that showed that for every 6 pounds that you're losing, you're also losing 4 pounds of, like, every
I saw that
6
too.
pounds of fat loss, you're losing 4 pounds of lean muscle mass. Now, there was a guy that I saw that was talking about how that was not necessarily true. That's in a very simulated environment, and that would be like if they just took it, sat around the house, didn't do anything, just went to work and came back home. If you are training, you're obviously going to keep a good bit more, if not all, of your muscle mass, and just be losing body fat. But to be clear, you are also going to be way less energy. Your brain function is probably going to go down. Like these drugs are for people who
Justin did say that as well.
These drugs are for people who are diabetic and extremely obese. These are not for people who are, and you're still going to get people that use them. I have a client that uses it right now. He's not extremely obese. He is a little obese and he's lost a lot of weight. It's been great for him. And the thing is, he's training. He's also on testosterone. And so he kind of counterbalanced those other things, right? And he hasn't had any issues. But this is for more long-term use and for people who don't regularly train. If you're taking semaglutide, it can have negative effects on other things just besides. It's not an end-all, be-all. You can take it for a year and then you're never going to have fat again. You're still going to have to learn how to diet and train and everything else.
And that's a thing. Practical application, we talk about that all the time. And like these studies, it's like you have to be very careful when you're looking at them, what the subject, like the subject group is. When we're talking about using these in people who we are talking to, of course, we're not trying to talk to the average who don't work out, aren't active, get 1,000 steps a day and eat like shit. So if you're that person, you got a lot of things to work on before you throw in a drug to, do the work for you. No drug is going to do the work for you. So stop being a bitch and just fucking do it. You can absolutely lose fat. I lost fat with zero supplements, zero drugs whatsoever.
Caffeine,
and I got
caffeine
shredded.
For me, and that was about it.
I drank a fuck ton of caffeine.
I lost 70 pounds doing nothing but walking and caffeine, training and cardio.
That'll do it. But the two that I do want to touch on before we get off here, because I've been using them, they've been wonderful. Number one is 5-amino 1-MQ. So again, like I said, these are technically classified as like molecule gray area, they're not steroids whatsoever. They're not necessarily peptides either. But what they are is damn helpful. So 5-amino 1-MQ, this one is slightly expensive, but in my opinion, it's pretty worth it. So this is going to be like enhancing fat metabolism, right? You're going to be inhibiting NMT. So like the 5-amino will increase like the breakdown of your stored fat. It's going to use that for energy. So that's going to really help you reduce your fat mass. It's going to reduce the size and number of like actual fat cells, making it easier to like maintain that weight. Or that like fat composition that you want. This is why, like, even right now in a growth phase, I'm using this. But it's going to improve like your metabolic health. It's going to lower your cholesterol. Studies have also shown it can reduce total cholesterol levels. So, helping it does have cardiovascular like improvement things that come along with it. It's going to regulate things like your blood sugar, enhance your insulin sensitivity, better blood sugar control, reduce your risk of diabetes through all of those things. So at the bare bones of it, it's basically going to just promote the fat, your fat to break down to turn into energy. So where we're not using when we're burning fat for that energy, we have a lot more of our things like, the carbs and the proteins and things. All those things are going to go straight to our muscle recovery, muscle growth, the things where we actually want it to go to. And then we're going to be burning body fat, throughout the day. So it's kind of like we use like L-carn, if you inject that, you do that fucking fasted, you go do your fasted cardio, and you're going to have that improved fatty acid metabolism within that time frame. With these, we can kind of have that throughout the day, and we can run these, every day. You don't have to do it fasted. You don't have to do it in any certain like time window. You just take with 5-amino, I'm doing 50 mgs a day. So in the morning, it's just one capsule. Take that. They're not injectables, which is also really good. Supports your muscle growth recovery as well, like preserves your lean muscle mass while promoting fat loss. So it's really weird. Like, you're able to do both at the same time. Like, obviously when we see new people or people body recomping and things like that, that's where we usually see that fat come down and that muscle go up. This allows even me, who is not in a position to do that super well, as I already have a decent, composition and a good amount of muscle, still achieve the fat burning while really, really building my muscles. So it's been huge for me. in this growth phase, keeping my waist tighter while still adding on weight. I know there was a period of like a few weeks where I slept on like 4 pounds and my waistline went down.
I have a question.
So,
what is the mechanism of action for those two compounds? Like, what is it acting on? Or do you know, like, what is it acting on? So for instance, like clenbuterol, right? It's basically, it has a certain reaction to a certain thing. Then you have like, what is it called? It's the one that Justin talks about. That's like a fat loss one, DMA or something like that, or DMT, or it's not DMT. Oh my gosh, what is it? But basically what it does is it raises your body temperature, and that makes you burn fat, more calories faster. You know what I'm talking about? Like what do those two compounds, what do they act upon to create the fat loss?
So it's a very weird, the second part of this is a very weird word. I forget the pronunciation, but it's nicotinamide in like methyl transase or transferase. I don't know how exactly you pronounce it, but it's an enzyme basically. So it's found in like your tissue, primarily like liver, fat cells, so adipose tissue, muscle, and this plays like the major role in your metabolism, like your energy balance, your cellular function, everything that goes into your fat storage. So it inhibits that. So it allows your fat to be utilized and mobilized for that energy.
So does it blocks new fatty acids from like connecting to your basically fatty acids from turning into actual like okay, sweet.
Yeah. And it'll just take,
the reason I asked is I wanted to know if it was going to make
opens that up. Make you what?
I was just gonna say I wanted to know if it makes like your body. Does it make you warmer? Does it make your body heat go up?
It's not a stimulant whatsoever. So it's not going to raise your heart rate. It's not going to raise your heat. It doesn't work off of that. All it does is it flips that to where your body is going to reach, and it opens that door for your body to be able to utilize and mobilize fat more. And primarily, that's really what it is. Your body's going to primarily reach for the fatty acids for energy. So that's why I said like that's what L-carn is basically for, right? You take that, you do it fasted. It's kind of like that, but without those effects of heating your body up and running up your heart rate and those things. That's why you can do it and have that effect throughout the day.
Do you need to have a lower fat diet? I know
no.
I'm asking these for people out there. I know what your diet is, so I know that you don't have a low fat diet. But like, so that's the reason I'm asking is like, you don't have to have a low fat diet or low. No, I don't mean a low fat, meaning like almost no fat. I more mean like you can still be eating 80 to 100 grams of fat and still be fine.
Yeah, I mean, I'm eating 150 right now.
Okay, cool.
And I cook my meats in untracked extra virgin coconut oils, so I am getting in insane amount of fat, and it is not doing a damn thing to my body.
Are your carbs low?
Fuck no. Okay. Everything is really high. And that's the thing is like when you don't have to worry about the calories that we're burning are like when you don't have to worry about whether it's going to be glycogen or whether it's going to be, from your stored carbs or whether it's going to be from fat, and you don't have to set up these, perfect time windows so that you like in a fasted cardio state with something like L-carn or these things that promote that fatty acid metabolism. When you don't have to worry about which one of those your body's going to do at that certain point. We already know that this is going to have our body primarily using fat for energy. So that means all the other nutrients that we have and that are going to go to the growth and the repair and all that kind of stuff can all be utilized for that instead of burnt for energy, right? So you honestly probably want a little bit more fats in your diet.
Right.
It's going to allow you to take in more dietary fats. So
well, that's kind of what I wouldn't say.
Don't jump your fats to 200 just because you're like, all the fat that I intake is going to be burned. That's not how it's going to work. But
right. That's kind of that's what I was asking for, because I was like, because some people will hear that and say, okay, well then I need to cut my fats down so that I'm burning the most amount of adipose fat that I possibly can.
That's a good question.
You see what that's why I'm asking those questions specifically, because I want to make sure that people understand that you still need those healthy fats going in because your body functioning is
needs
your
those
hormones all function off of fat, especially healthy fats coming in. So yeah,
you
that's why I
should
wanted to make sure we got that.
you should rarely, and I mean rarely, have extremely low fats. Very rarely. There's very little
what's extremely low
scenarios where I
fat to
think
you?
Male or female.
Well, male. You can do male and female if you want, because I know it's different.
If you'd asked me this a year ago, I would have said 50. Now,
Okay, for males,
shit, dude. If you're at 60, 70, even that's like we should be able to bump that up more.
I sit at 70. I sit at 70 year round. Well, I
That's
don't
what I'm
eat.
saying.
I don't actually eat at 70 year round. But for me, low fat is 40.
For a male, like
I'm talking
that's going to be.
I'm talking about a prep. I'm talking about lowest of the low. Yeah,
that's what I was.
That's what I mean.
Which even then, that's where a lot of coaches that I'm now kind of learning is that's where a lot of coaches fuck up is the fats are too low.
They want to put it down to 20, 25 grams. I'm like, what are you talking about?
We can't be doing that. What are we doing? We need hormones.
Yeah.
So
you need hormones. Yeah. Like, come on, man. Even though you're injecting them, it's still like you still need those other things.
You might be injecting testosterone, but you're not injecting every other hormone in your body, and fat is used for all of that. So
everything.
We definitely don't want to do that. But yeah, that's what 5-amino is great for. It also has anti-inflammatory properties. It has energy boosting properties. It's going to give you all that. You're going to feel increased energy output. You're going to have better fat mobilization. You're going to be able to grow and push things without gaining excess body fat that you don't want. All of those things. Again, this is another one that's like, hey, we don't have a ton of long-term, especially this one, studies on or anything like that. But from what I can see right now, this isn't a thing that we need to worry about cycling on and off aggressively. I think this is definitely, in my opinion, something that we can leave in for quite a while, unless we get to a point where, unless you're doing too much or anything like that, you might get some stomach issues from it, or maybe even like some fatigue or anything like that. But that's just, you're probably doing far too much. And then again, the other negatives are kind of just like the cost. It is pretty expensive. Depending on what your money is looking like. And whether you're able to even get it or not really depends on where you're at too. So, but yeah, the other one that I'm using is SLU PP332. So this is again another enhances your metabolic rate. This one actually activates like your estrogen receptor related, like your ERRs is what it's called. It's estrogen receptor related orphan receptors or something like that, something weird. So it increases your energy, like expenditure, your fatty acid oxidation. It mimics the effects of exercise almost, right? So it mimics the metabolic effects that you get from working out.
And no effect on the heart, right?
No, none of these are going to affect any organs, anything like that. That's why I love these, and that's why I say you can leave them in for quite a bit.
That's why, these could replace things like Clen, all the Yohimbine, all those ones that do have a negative effect on your heart long term. Even caffeine.
Yeah. Well, and that's another thing. This one has this one also improves your endurance and your output, your energy. But the big one with this one is it enhances the mitochondrial function of like your skeletal muscle cells. So the more we can power the mitochondria, which is the powerhouse of fucking everything, you're going to have increased, like I said, endurance and just overall better output. Along with, again, you're going to have basically exercise mimicked effects throughout the day, which is obviously very nice when you don't have to do excess exercise to get the calories burned and get the fatty acids mobilized. So both of these things are basically just going to compound together to where we are utilizing and mobilizing fat for energy at the most efficient rate. Your mitochondria is powered. We're having boosted energy. We're having boosted output. We're having minimal fat gain even as we're pushing food up, things like that. Like I said, it's my main thing is I don't want to blow out my proportions and specifically my waist, right? So the more you let that go, the harder it is to tighten it back up. So minimizing that fat gain while also being able to push food, because usually like we don't have these things in, we don't have anything, right? You're just, let's say you're on testosterone and all you have is cardio, exercise, like lifting and food. There's going to get to a point where like you're raising that food and you're raising that food and you're raising that food, and like that's where we get into that point of like wanting to have it happen quicker than it can happen. So if we can put something in that's going to allow us to raise the food and not have to be so conservative about it in terms of like, oh, well, you know, he's already putting on a little bit of fat. If I move this food up at all, you know, we're either going to have to pound the cardio or we're going to have to, you know, minimize the food or whatever. We're going to have these in to where you can do minimal cardio. Like I do 2,500 calories a week, which isn't too much. It's not a lot really at all. I remember doing 5,000 calories a week. That was fucking hell. It was like an hour plus a day. So you're going to be able to do minimal cardio. You're going to have your fat being mobilized for energy quite a bit more than you would if you didn't have that. Now, again, it's not going to be like, hey, every single, you know, ounce of energy that you have, your body's going to only use fat, but it's going to be primary. What's the word I'm looking for? Your body's going to reach
primary energy source.
Yeah. It's not going to be a secondary energy source anymore, and things like that.
But your body probably functions. I mean, it's been proven by all these keto people that your body probably functions a bit better when its primary energy source is fat. It just is really hard for people to switch, to get their body to switch to that. You know what I mean? It really is. That's the most difficult thing, probably.
It is. I had a client who had like some pretty bad insulin resistance problems, and we wanted to fix it quick. It was weird. I pulled his carbs, dude, almost to zero. He had 50 grams of carbs pre-training. That's about it. And bro, his body switched to like fat mobilization like that. It was weird. Like his gym performance skyrocketed, his sleep skyrocketed, his overall like mood and energy skyrocketed. So like now this was because obviously he had some pretty bad insulin resistance before, so his body was not utilizing nutrients good whatsoever. So when you pull those out and you don't have those insulin spikes anymore and your body has to have energy from somewhere, it's going to pull from those fat storages. So this is kind of a similar thing. Instead of without having to pull out the carbs, now your carbs are just utilized for the things that you want it to be utilized for: recovery, you know, muscle building, regeneration, things like that. So these two things are pretty, as far as I've seen so far, working very, very well. It can definitely have some great effects. It also has like, it can alleviate like metabolic syndrome components. So like glucose, like can help stabilize your glucose metabolism and reduce fat mass. And it's probably pretty good in obese people as well, without having to destroy their appetite or anything with something like a semaglutide, retatrutide, those things. So I think we'll start to see a lot more research on these as time kind of goes on, because these are very very new.
We'll see. You know how people are with research and stuff this
inside of us.
Yeah. But I'm just saying,
our
like,
industry.
I wish that we could get more professional, like legitimate research done on this, long-term research on multiple ethnicities, multiple groups of people that live in different places that do different things. And that would be really nice. It would be nice to have a group that is non-working out, that never works out, versus ones that work out, 3 times a week, 5 times a week, that type of thing. But me and you would have to become doctors and put that shit together.
Yeah, let me go back to school real quick. Fuck no.
You don't have to be a doctor to run research. You don't have to have the.
You just said we'll become doctors.
I mean, we basically already are doctors at this point.
All right, calm down.
I'm just gonna from now on,
PhD
doctor
right here.
Hey, listen, I got my documentation right there on the wall. It's enough.
Thompson, PhD. I don't think so.
I'm gonna go get mine from the University of Phoenix.
You going back to school? Yeah, right.
Online.
Yeah, get your PhD online for sure. For sure. That's super credible, bro.
Yes,
that's super credible.
That's the doctor I want to see.
Didn't have to do a single hands-on experiment.
Those 2020 doctors are going to be insane.
Honestly, 50 doctors might be all online. You never know.
Dude, they probably will be. Gosh.
But yeah, man,
man, that was a good episode.
Hour and a half of peptides. Like I said, there's probably some other ones we'll talk about in some other episodes. There's a shit ton of them, but I think we covered a lot of the popular ones right now, and the really useful ones. That's another thing. Is like there's some that are just like not that useful in terms of benefit versus risk, risk reward. But
and if you want to hear, like, if you have other specific ones you want us to talk about, leave them. I don't know
comment.
What's the podcast comment? What is it called? There's a name for it. The review.
Well, it depends on where you're at. There's reviews on like Apple Podcasts, but then this goes on YouTube too, so you can always put comments under the YouTube.
Yeah. Leave us a comment, DM us, whatever the case is. Mm-hmm. If you have questions about specific peptides, we'll be more than willing to answer those questions. But yeah, thank you guys for listening.
Yeah.
We'll see you in the next one.
This was episode 9, I believe.
9 or 10? Yeah.
Yeah, it was 9.
Crazy.
Appreciate y'all. We out.
Peace.